Hi, my name is Jay and I'm from LifeRx Wellness and Home Massage Service in Los Angeles. And today we're going to talk about gout. So what's happening with the gout? A lot of people call us and say, I have a foot problem, a foot pain, please come on and do massage. So let's just be more informed how massage can be beneficial for the gout and what we can do, what massage therapists can do for you. So let's first of all identify what the gout is. Gout. Sorry for my accent, but it's inflammation of your foot. Most of the time, it's inflammation in the big toe. It's called podagra, or sometimes other metatarsals. And what's happening? You feel that swelling, you feel this redness, and sometimes people after a run they come to the clinic, or we go to the houses and they say, oh, I feel this foot pain. And when you start touching it, yeah, it's really sensitive, and this is the gout. So what's happening with the gout? It's too many uric acids in your blood, and this is shooting right to this metatarsal, and this is the first symptoms and first attack of gout. So how this happened, why we have this problem? Usually it's after 45 years old, after 45, 50 years old, this diseases start progress. Why? It's not right diet, it's not right eating, especially red meats, shellfish, a lot of sugar, alcohol, beer. Guys, if you love beer, not gonna be good. I love beer till it's happened to me. So when my leg starts swelling, I stop drinking beer at all. I know I'm a quitter, but I feel much better, and I don't have attacks since then. But beer, it's a number one cause for your gout and thus joint inflammation. So be careful. Also sugar, high fructose corn syrup. That's what really inflame those joints and increase your uric acid in your blood. So the diet, it's a number one cause of this trouble. The next problem is a dehydration of your body. If you don't drink enough water during the day, it's gonna cause this problem in the future. Your joints are gonna be inflamed. Guess what? You're gonna lose this mobility. You're gonna lose function of your joints. It's create arthritis, crystallization of your joints, damage. You don't want to go that way. So you're gonna ask me what to do when you feel the gout. First of all, it's of course medication. It's really quick to release the uric acid in your blood. It's a specific medication for it, and it's work really well. But if you want to go natural remedy for gout, I highly recommend cabbage. Yes, you're gonna be laughed, but the cabbage. So what do? You take a leaf of the cabbage, put it in the boiling water for 2 minutes, hold it for 2 minutes. After, make sure you're not gonna burn your skin, apply to this area and wrap it with a food plastic wrap, or just a plastic bag. And go sleep. You'll see it's gonna be tremendously help you. And this is the number one natural remedy for gout. But if you feel this inflamed, I highly recommend just take a medication. It's a bunch of medication for this problem, and it's helped a lot. You're gonna feel really good. Next one, it's a celery juice. Celery juice drink. It's gonna neutralize your uric acids in your blood, and it's gonna be really help. Cherry juice is also good. Fish oil, omega-3, omega-6, great. Also, you have to take magnesium all the time. Magnesium. I always tell my customers, take magnesium. Magnesium, it's natural, it's always good for your body. So how massage can help you with a gout attack? If it just happened today and you're frustrated, you're in pain, you try to call any doctors or no one available, you always call a massage therapist. I highly recommend do not do massage in this area because it's really sensitive for the touch. All you can do, the therapist can do lymphatic drainage massage of your upper partial of your foot. So basically it's a calf muscle. That's gonna help, but not tremendously. So the first thing first, you have to do cabbage, medications, celery juice, and try to not dehydrate it. So drink a lot of water. When your symptoms is going down, when the swelling is not there anymore, I mean, you still feel a little bit, yes, the massage is really helpful. You can bring more blood and heal it. Also, They mobilize the metatarsal. So work on those fingers and separate them. Make sure the foot is working properly. It's mobile. This is really important too. If you not have a mobile foot, it's a lot of it's a blood circulation problem. So this is also can be problem in the future. So massage is really helpful for the gout attack only after the symptoms is down. So I hope you guys find this information helpful. And now we're going to demonstrate what we can do for you if you have a problem with your foot, if you have arthritis or gout attack. Okay, I have a client on the table, and what I'm looking for all kind of swelling, all those bumps. I'm always look at the big toe. It's really important. If you guys feel that bunny toe, that's mean the person is walking kind of inverted. That's mean the flat feet or not enough mobility in the ankle or stability. So this is another. I also look at the finger, the big toe. If he's gonna go 90 degrees, I have to go all 90 degrees. It's a little bit limited. It's not that bad. Sometimes you can't even move that big toe. That's a first call to work on it, mobilize that area, because that's can cause a lot of problem for your hip, for your lower back. Make sure this big toe is mobile enough. So what I'm doing here, I always use that Quanta muscle rub, and it's arnica in there, mint. It's always good for our joints, always good for our joints. But like I said, the best, it's a magnesium, calcium, and of course hydration. So you need to drink enough water. So I'm gonna apply, and what I'm doing, I just try to work on that fascia and see how's the foot working. So I'm opening up here, warm up the tissue, drag all the way down. And of course I work on tibialis muscle and shin muscle here. Here we go. So the next part, I'm kind of bring my fingers under the foot and I open this up. And I'm go each individual metatarsal. So let's say I'm at the big one and the second one, and I'm open this up. So I'm doing that. I'm open this up. So now I go to this third one, second one and third. How's it feel, Marina?
Good.
Always communicate with your customer. So I'm open them up. I'm kind of roll it up. Next one, after we roll all the way up, warm up the tissue, what you do, you grab individual toe. Let's say we start with the big toe. I push it in. So I'm doing that kind of movements, in and out. Very light, very gently. How's it feel? Say good. Now I'm doing a little bit of rotation. So you see what I'm doing here? Okay. Some people doing this way. You can, and always make sure it's no pain, because for older folks, they have so many arthritis up there. Sometimes it can be really painful. Okay, we're gonna go to the second toe, just demonstrate you. Sometimes people doing that, like flipping, squeezing and pulling. I don't think it's a good idea with gout attack, or any arthritis problems. Very gently. You always want to bring the blood through this area and mobilize those joints. Now what I'm doing, I work on this top partial of the foot. Really deep. You can work this way. Try to separate it. It can depends on the person. Like I said, very slowly. Go a little bit fast for the camera purpose, for the duration of the film. But you go always slow. You take your time. Okay. Next one, I bring this leg on this, foot. The next one, I bring the foot on the side. I grab right at that big toe, and this is the navicular bone, and I'm doing kind of twisted in and out, just like that. So this is what I'm doing. I want to mobilize that part. Yes, so really take care of your foot because it's really important. If your foot is not mobilized, if your ankle is not worked properly, you're always going to have problem with your lower back, with your knee, with your hips. Okay, now I work on this talus area. This is really important. The talus area is have some mobility too. What I'm doing, I place my both down like this, and I'm lean on it, and I push kind of around. How's it feel? Sometimes really sensitive, really a lot of pain up there, so be careful. Little pain. So you see, yes, because most girls, what they do, they're wearing those heels. In that area, it's kind of stretch, and it's really painful, and it's locked. That talus bone and the tibia and fibula, it's kind of a little bit jammed, so it's really important to mobilize that area. Okay. And the final one, I'm come up on the heel. I lock the heel like that, so it's not movable. And what I'm doing, I'm cover the whole metatarsal, whole foot, and I mobilize the full foot right now, just like that. Yeah, if this is a big person, you can jam this between your knee and work with both arms. I'm not going to do it today, but we already have this in our past videos. And you can repeat many times, and of course work on the second foot. So this is how we can help you actually mobilize your foot, make you feel better, make you walk better, and of course eliminate that gout attack and in the future, and upgrade you. So move well, move on.